Hi, I'm State Representative Mark Pocan, and welcome to my video blog. Today, as part of an ongoing series about the state budget, I'd like to talk about the cuts in health care. This is a good time in Wisconsin not to get sick because programs are being cut at a pretty serious level when it comes to health care in this budget. There's a $500 million cut from Medicaid programs. That includes Badger Care and Family Care. Now the difference in the past when we've had a much larger budget deficit is we said they could do some cuts through cuts and efficiencies, but not necessarily in service delivery, what people actually get, which is health care coverage. The Republicans this time, they actually have changed statute and programming without almost any legislative oversight. Only the Joint Finance Committee will have any oversight over changes that the department decides to do. So you could have significant reduced either access to health care or how much you pay for health care when you already are some of the poorest in Wisconsin in order to get health insurance. So this $500 million cut is a very different cut, and now it's a much more significant cut than we've ever seen before. They also limit access to affordable health care for people most in need, and they have capped enrollment in family care. And what that means when you cap enrollment in family care is you're making it harder for seniors and people with disabilities to be able to stay in their homes, which is part of the idea behind family care, so that people can still have a more independent life. They also cut funding for programs that provide immunizations, cancer screenings, as well as funding for people with autism, diabetes, and heart disease. And finally, something that got a little bit of attention, they've cut $1 million a year in state funding for women's health care centers statewide by defunding Planned Parenthood. It's a direct attack on a group that they don't agree with ideologically, and despite the fact that 98% of what they do is around providing comprehensive health care with cancer screenings and other things, they've decided to cut $1 million in funding to Planned Parenthood. And also at the UW hospital, they have decided to say they can never offer abortions, which they currently don't offer. But they're not allowed to do that. So a lot of different provisions happened in healthcare, but most significantly, a $500 million cut, of which is really unidentified and could turn out to be significant reduction in healthcare that's offered to people and significantly limited access to healthcare. And that's part of what we're going to fight in this budget. So we'll have more on other parts of the budget, but right now I hope you just didn't get sick from watching this video, but don't. It's a really bad time in Wisconsin to get sick.